Welcome to our short film on our latest publication, Stepping Up Breaking Barriers, Transforming Employment Outcomes for Disabled People. This is the third and final paper in our series on employment and support allowance, which is the main incapacity-related benefit for people with a health condition or a disability. In the last paper, Working Welfare, we focused on the design of the benefit system itself, which we see actually as quite a significant barrier to people moving into work. In this paper, though, we focus on the employment services and the role of employers in helping disabled people and people with health conditions to move into sustainable employment. One of the key things that it's worth mentioning that this government has done is to drastically reduce the amount of funding available for outsourced welfare to work programmes. So that's programmes delivered by the private and third sector. And in our paper, we argue that this is a backward step in terms of the provision available to disabled people for two real reasons. Firstly, outsourced providers can have very deep supply chains with lots of specialist charities and organisations within it. So you get a real diversity of provision that Job Centre Plus simply can't replicate. But secondly, an outsourced model allows you to shift financial risk. So it means that in a payment by results funding approach, you pay for what works, and you pay for success, rather than just paying for a service which may not actually move people into work. And of course, that's certainly not value for money, and in Job Centre Plus, you're simply paying for the service regardless of the outcomes they achieve. So first key point, please can the government revert back to ensuring that the main welfare to work provision is delivered by external providers. What we're saying is we think the work programme and work choice have been pretty effective, but we think they can be improved. So I'm joined by Ben, who is one of the co-authors of the report. Can you just tell us a little bit about how the work programme funding model can be improved?
Yeah, absolutely. So I think there are two main points around the funding model. One relates to the size of the overall funding, and the other to how you actually use that funding and distribute it between different participants. So on the overall funding size, we argue that the government should return to the Amy Dell switch that was supposed to be in place for the work programme, and what that means is programme expenditure is funded from the savings that would be realised down the line of moving a long-term incapacity-related benefits claimant into work, and what we've found is there is significant capacity. So that saving is significantly higher than what we're currently willing to spend on moving them back to work.
Yeah.
On the distribution of the funding, so one of the main problems of the work programme has been the parking of the hardest to help claimants, so they've been left because they're less likely to yield a job outcome payment. So what we're saying is introduce an accelerator payment model whereby providers are paid incrementally higher fees the more people they move into work. So that means that the highest financial reward is always attached to those who are furthest away from work, and so there never are incentives to park them.
And of course, it also means that you're not defining someone's difficulty to help by the benefit they're on. You're actually seeing how long it takes, and the longer it takes, you assume the harder it is, and therefore the more money a provider will receive. So one of the other, I guess, criticisms of the work programme was that it really hasn't delivered the innovation that was hoped. So interestingly and slightly worryingly, we really don't know what works for people who have disabilities or health conditions, partly because actually typically this is a group of people that haven't been required to engage with programmes, so I guess there isn't quite such the evidence base. What we really do need is innovation in the next model that the government goes for. Can you talk a bit about how you think that could be achieved?
Yeah, so this I think is one of the most exciting recommendations in our report, which is to move towards what we call a skunk works model, as it's known in the private sector. And there are sort of three main things to say about the skunk works model. So it would be a proportion of all the participants that a provider receives. So say they receive 1,000, maybe 50 or 100 of them are referred to this slightly different group. And in this group, the funding envelope would be slightly higher, so that providers have a bit more money to do things that are a bit different and a bit more innovative. The performance metrics would be a bit more lenient, so that they're not punished for failure, because to do something really innovative you do need to
take risk.
Exactly. And the third important thing about it is it must be absolutely transparent. So that means both them indicating to the Department for Work and Pensions what they're intending to do, so we know that they genuinely are doing something new and innovative, and so that the department knows what it is they have done, and so they can be piloted thoroughly and we can start to build an evidence base.
So essentially there's a evaluation involved, so whereas typically we would see the programme continuing the black box, which effectively means providers use their professional judgment, can deliver the services they see best for that local area and for the individual claimant they're seeing, and they don't need to report on what they're doing. In a skunkworks model, you'd have to be absolutely clear about what had been done and the impact it had. So then we would, as you say, have that repository of these things work, these things don't work, which obviously is essential in driving better outcomes for this cohort. Then in terms of the second half of our report, which focuses on the role of employers, I think it's often the case that we focus very much on the employment services, and we don't really focus much on, well, what is the role of employers? And of course, we can get these employment services right, but if employers are too worried about taking on a disabled person, or they don't understand what they need to do, or the workplace isn't appropriate for that disabled person, then it doesn't matter how good the employment services are, because there's not going to be a job for the individual to go to. So we make several suggestions in this area, and I want to touch on three very briefly. So first of all, the government is running something called the Disability Confident Campaign, and this is the main badge, if you like, that the government uses, a kind of kite mark on whether a business is appropriate, doing appropriate things, is supporting disabled people in the workplace. Actually, what we've found is that very few of those businesses who are disability confident are actually active participants. So what we're saying is the government need to give this programme teeth. They need to require those businesses that are involved in disability confident to actually be performing against a framework of formal standards. That could include, for example, offering work experience placements to people with disabilities. It could be using apprenticeships. It could be around recruitment, retention standards, all those kind of things, and actually that information must be publicly available so that those businesses are held accountable for actually delivering against it. The second area is around trying to reform access to work, which is the main benefit that disabled people can use to get the funding needed for workplace adjustments or workplace support adaptations. What we're saying is it's quite a complex bureaucratic process that needs to be simplified. You should be able to apply for access to work online. It should be much clearer for small businesses in particular to understand what that process is, and individuals should have essentially an access to work account from which they can use they can draw on a catalogue of items that they might need. Obviously that would be 4 items that are appropriate to use on that. Things like personal support workers, hopefully in due course, might be able to be included. And the final recommendation, which Ben, perhaps you could talk a little bit about, is around actually having a index of inclusivity.
Yeah, so we looked at the Stonewall Index, which is for LGBT employees, and what that does is it provides a publicly available ranking of different businesses, and it's informed by LGBT staff who are currently working there. Yeah. So it's based on asking them how inclusive do they feel on a day-to-day basis in work, and it ranks it, and it's publicly available is the crucial thing. And that has been found to be really very successful, both in its uptake, so many businesses are involved with it, and we get the sense that businesses really do care about where they come onto the scale. Yeah. So we think something akin to the Stonewall Index for disability could be really effective.
Yeah, so very much industry-led then,
exactly,
in that instance, which is great. So they're the key recommendations from our, as I say, third and final report in the ESA series. Obviously, we'd be delighted if you go and actually read it. It's on the website. And otherwise, thank you very much for listening to us.